I think there's a problem from the back end.
डॉक्टर ललित रीस्टार्ट हो गया है, डॉक्टर मनप्रीत को बोलो प्रेजेंटेशन दोबारा शेयर करिए।
Okay, sir. Yes, she's joining. She's joining. Just a minute. She's.
Okay. Audible?
Yes, ma'am. Yes, ma'am.
Okay, I think I'll have to restart the presentation. Just give me a second. All right. Audible again, clear. The screen is clear?
Yes, ma'am. Yes, ma'am.
So maybe I will just repeat this slide because it is very important. So I'll just go quickly over it, that obesity, as I said, is no longer just about a cosmetic response from a person, that this person is fat or is healthy or is chubby. It is more than that. It is a disease. And it is because of three reasons. One is that it itself, the fat tissue, it evokes an inflammatory response, because of which the chances of various complications like dysglycemias, hypertension, non-alcoholic fatty liver disease, menstrual dysfunction like PCOD in girls because of high insulin resistance, dyslipidemia, early puberty in girls, delayed puberty in boys, and the chances of high uric acid, microalbuminuria, gynecomastia, cholecystitis. All of these are the immune responses or the endocrine responses to the abnormal fat. The physical response in terms of the fat per se is in the form of asthma because of poor chest wall compliance in cases of obese individuals, immobility because the larger weight you are carrying, the more difficult it becomes for you to move around, lipomastia, tissue compression in the form of sleep apnea, obstructive sleep apnea. We know in children who are obese because of very large amount of fat in the subcutaneous spaces in the neck can lead to falling back of the tongue and then sleep apnea, gastroesophageal reflux disease, tissue friction problems like intertrigo, fungal infections, very common in children who are obese. Stress on weight-bearing joints, which can lead to slipped capital femoral epiphysis, Blount's disease, scoliosis, and even early osteoarthritis is seen in patients, in children and adolescents with early osteoarthritis, with children who are very obese. And often which goes unlooked at, is the psychological response, how these children are actually struggling silently, but on the face of it, they are quite defiant. They do not want to change their ways, but they're internalizing a lot of negativity. They are subject to bullying. They are not able to participate in age-appropriate childhood activities. There is a high incidence of anxiety and depression, especially in girls, adolescent girls, with binge eating behaviors, night eating behaviors, bulimia, etc. And again, more common in girls. So looking at this, we understand, looking at all these responses, we understand that this global epidemic, this problem needs to be handled on a urgent basis as a society, as even at the level of the Indian Academy of Pediatrics and at the level of the policy making by the government. Now, when a patient comes to us in the OPD, what are the signs that we can ask for in terms of symptoms and signs? So snoring, if you ask for a history of snoring, it could point to the presence of an obstructive sleep apnea. If the child is persistently complaining of headache, it could be because of hypertension or because of benign intracranial hypertension, again, because this is a response again because of the higher weight. There is an increase in the production of the CSF. There can be a limp, which could be because of again, physical factor, because of slipped capital femoral epiphysis. It could be in the form of a limp, or a referred pain in the knee, or a back pain could present with SCFE. The presence of hirsutism or irregular periods, acne in girls who are adolescents after menarche could point to PCOD. Polyuria, polydipsia, fungal vaginitis could point to the possibility of a type 2 diabetes mellitus. And what you see in this picture is actually acanthosis, quite severe acanthosis, which is a sign of insulin resistance. Sometimes it is accompanied with skin tags. And of course, taking a blood pressure for all children should be mandatory, whether obese or not, because sometimes we pick up a lot of a few disorders just based on the BP, which the parents also might not be aware of. So BP specifically in the cases of obesity might point to a higher BP might point to a metabolic syndrome. So what about the workup? What do we do after having seen and evaluated a child and probably diagnosed him as a lifestyle mediated obesity? What do we need to do further? So if the child is clearly obese and overweight also, especially in the cases of adolescents, any child who is obese under the age of 10 and any child who is obese or overweight above the age of 10 should be worked up for comorbidities. And this includes doing a OGTT and a HbA1c to see the glucose tolerance, lipids to look for dyslipidemia, SGPT to see for the non-alcoholic fatty liver disease, and an ultrasound liver if that is optional. If this SGPT is also increased, then to see for the staging of the liver problems. So this is something that we can do, and even pediatricians at the clinic can do before referring to a pediatric endocrinologist if required. Actually, for simple obesity, referrals are usually not required, provided we have an intensive sort of a counseling and training for the parents for weight management. A lot of times, a lot of reports, they come with the reports of insulin also in the investigations. So that is not really required, and it has a lot of guidelines have now said it has limited role because insulin assays per se are not of a very high quality. So these are the pediatric cutoffs for various of the parameters that I talked about, and we see they're a little different from those of adults. I'll not be going into the details, but if anybody wants to take a picture, you can take. So what is this metabolic syndrome that we are all fearing? That children who are now obese will, probably this bomb will probably blast into the syndrome of metabolic syndrome when they are adults. So metabolic syndrome basically is a condition which predisposes people to the development of early atherosclerotic heart disease. And this metabolic syndrome is defined in children in the ages between 10 to 16 years, where a child has a waist circumference of more than the 90th percentile, plus any of the two, triglycerides more than 150, a high density lipoprotein less than 40, a BP of more than the 95th percentile, and a fasting blood glucose of more than 100. And there was a study which was done in AIMS in 2016, which showed that 3.4% of overall adolescents have a risk of developing metabolic syndrome. And out of the obese adolescents, about 45% of them have this risk of developing metabolic syndrome. There is another concept of role of the gut microbiome in obesity, and it is seen that because of certain factors starting from early life, the gut microbiome flora gets it gets altered. From there, in the gut we have good bacteria as well as bad bacteria. As long as the good bacteria are more than the bad bacteria, things go very well. But when the bad bacteria, of course, overpower the good ones, then is the problem of this obesity which starts. And there are multiple studies to prove that the gut microbiome is actually linked to the development of obesity, and the factors which affect the gut microbiome from going from good to bad is, specifically introduction of antibiotics very early in life, less duration of breastfeeding, introduction of ultra processed foods and energy dense foods. The genetics, of course, also plays a role, sedentary lifestyle, and all of these early in life lead to the changing of this gut microbiome and predisposition to higher incidence of obesity in later childhood and adolescence. Having talked about the common variety of lifestyle mediated obesity, just a little bit about red flags to the pointers of pathology. If any of these kind of children walk into the clinic, they need urgent referral to a pediatric endocrinologist. So obesity, which sets in very early in children less than 5 years old, if there is presence of any dysmorphism, any visual defects, hearing defects, skeletal defects, could point to underlying syndromes, developmental delay, extreme hyperphagia, that the child is always hungry, stealing food, he gets up at night also and looks for food. If the high weight is associated with poor height, this points towards an endocrine issue. So most of the times, the common garden variety will not have low height. They will actually have a better height than usual. So good height, good weight, or too much weight is exogenous. But good weight or very much high weight, but low height, less height, poor growth velocity, probably something endocrine like thyroid, adrenal disorders, pseudohypoparathyroidism, etc. Pubertal delay could be present in syndromes like Prader-Willi syndrome, etc. Anything where there is a rapid or a recent onset weight gain could point to an underlying hypothalamic problem, needs an urgent, or even something like Cushing syndrome needs urgent referral. Any where the child has had a CNS insult, any CNS tumor, any trauma, or there are associated behavioral problems, again, we need to dig into the pathology. Now, after having talked about the causes and the comorbidities, the management of exogenous obesity, I think most of our remaining talk will be based on this only. So very simply, as I said, when you explain to the patients, weight is a form of energy, it is energy in minus energy out. So you just need to tilt this balance by decreasing the energy in and increasing the energy out. So as far as adolescent and childhood obesity is concerned, this formula works very well. Although a lot of nutritionists and people who in this dietitian world will say that this is not as simple as it sounds, but to explain to the patients as a starting point, this is very useful. As long as you can explain in detail about what is energy in and what is energy out and what steps to take. As far as the energy in is concerned, dietary management, I start by telling. So in my clinic, we have certain proformas that we fill. We ask the patients to fill. It's about 70, 80 questions that we give them. And all those questions are actually leading questions. They make them realize, oh, this is what they were doing wrong. Oh, this is what they were doing wrong. So when they realize that this is what they were doing wrong, they themselves make the attempts to make that correct. So when the patient comes to my clinic, we first give that proforma to them. We take a detailed dietary history. And then in terms of management, my first step is that before you say कि रोटी कम कर देंगे, चावल कम कर देंगे, सबसे पहले आप packaged food diet में से completely eliminate कर दो. Sometimes they don't even realize what is packaged food, like biscuits, namkeen, chips, rusk, pape, cold drinks, Bonvita, Horlicks, all these. The list is very long. So that is what I tell them for the first thing. Decrease your fast foods, use water as a drink, eat your meals regularly together as a family, no screens on the dining table, reduce your saturated dietary fat intake for kids more than 2 years of age. Avoid constant grazing all the time, especially after school and in the evenings. That is when most of the children end up eating junk food. Recognize eating cues that you are actually not hungry, you're actually bored, you're actually lonely, you're actually on the screen, so you're munching something. So it's not that you're hungry. So eat only when you're hungry, and definitely don't use any screen while you are eating. Is physical activity is concerned, when I talk about physical activity, I divide it into two parts. One is active exercise and the other is movement. So a lot of times the parents say that, हमने तो उसको badminton class में लगाया है, हमने तो उसको cricket class में लगाया. But what happens is that most of the times they're just waiting for their turn. They're only playing for 15-20 minutes, or the classes are only MWF, TTS. So this very detailed history has to be taken, and they have to be told, yes, 1 to 2 hours of actually vigorous physical activity in the form of exercise, and the remaining time when they are at home, instead of just sitting in front of devices or in homework or XYZ, ask the child to get up after every 30 minutes, 40 minutes, walk for 5 minutes, 10 minutes, or do some, if age appropriate, household chores. They can fill water bottles, they can water the plants, they can walk the dog. So get them involved in the household activities. This way they will increase their steps. I tell a lot of my patients to even wear a smartwatch, or not a watch, a fitness tracker, anything from the cheapest, whatever is available, and wear it in the morning and put it down in the night and see how many steps you have done. And at least they should be doing 10,000 to 12,000 steps a day to lose weight, and 10,000 to maintain. So a lot of times parents do comply, and sometimes even schools give permission when I write a note to them. So these are objective ways of showing them, okay, so this is why you do not lose, because you've not done the steps, even though you've reduced your eating. So adopt healthy practices at school and home, use stairs, do small household chores, don't order in bed. Parents have to be educated that don't run behind the child, understand that what is responsive feeding, just don't try to give them food all the time, involve them in household chores. And sleep is also a very, very important part of obesity development. So a good 8 to 10 hours of sleep is required by most of the children. Adolescents around 8 to 9 hours, and less than 10 years around 10 to 12 hours of sleep is required every day. I think I will probably end the presentation here, because we will have the other speaker also speak, and we can take it in the question answer session. Just wanted to say that last year, on this World Obesity Day, the IAP had premiered these awareness videos, a very nice kind of small films that they had done for awareness about obesity, and it was circulated, but I think it has still not reached to a lot of audience. So this is Disha 2 U-Turn, which was produced last year on World Obesity Day. About the pharmacological management, either we can take it in question answers or we can take it now. Should we leave it for question answers or should we take it now?
You can continue with the pharmacological management.
Okay. So as I said, the cornerstone of management of the common variety of obesity is intensive lifestyle modification. However, there are a lot of families who come back either without making good attempts or without the child complying with them, or even after making a decent amount of attempt, there is very poor response in terms of weight management, in terms of the weight, as well as a lot of them are already suffering from comorbidities like type 2 diabetes, high cholesterol, even hypertension, and insulin resistance. So it is in such certain subset of these patients that we resort to pharmacological management. And this management is to be used mostly in obese children only, not so much in overweight children. These drugs that I'll be talking about, they help to reduce the BMI, but if they don't reduce more than 4% in a 6 months time, then of the BMI Z score, then it's best to stop these treatments. The classical treatment which everybody uses, which is off-label, is being used as metformin, which is used mostly for patients who have significant insulin resistance with or without type 2 diabetes. And it actually is not FDA approved for weight loss, but it has been observed that when it is used in the right subset of patients, it helps in losing about 2 to 3% of weight, and definitely decreases the incidence of the diabetes mellitus in cases who are impending or pre-diabetic, and helps to improve signs of insulin resistance and PCOD type of symptoms in adolescent females. So metformin is a drug that I use regularly in certain subset of patients. Orlistat is a pancreatic lipase inhibitor, which is actually FDA approved for kids more than 12 years. What it does is that it prevents the absorption of lipids in the small intestine, and it gets excreted out in the stool. So there is very oily kind of stools, but about 30% of the fat is excreted in the stools. The fat reduction, weight reduction is very modest. If tolerated, most of the patients leave the drug because it is not tolerated very well. But if tolerated, it's to the tune of about 5% if it is taken for about 6 months, around 6 months duration. Nowadays, as all of you must have heard, that the world has opened up to GLP-1 agonists like semaglutide and tirzepatide, which is a GLP plus GIP-1 agonist, and the pharma industry is pushing it massively for weight loss. Practically, I have used it in a few adolescents with a good response, and even in adults, there is a lot of data to show that the response is very good, to the tune of losing almost up to 20% of body weight, excess body weight. Now, GLP-1 agonists have multiple mechanisms of action. Most importantly, they work on the stomach and the intestine by decreasing the gastric emptying, decreasing the gastrointestinal mobility, keeping you with a sense of fullness for long, so that the patient or the child does not eat more. So the food intake is cut down directly because of the sense of fullness itself. Directly also, it acts on the brain appetite centers and decreases the food intake. It has a hepatoprotective effect on the liver and reverses the cases of NAFLD. On the muscle also, it increases the insulin sensitivity and glucose uptake, but also very importantly in the pancreas, it increases the insulin secretion and decreases the glucagon secretion. And in that multi-pronged way, it is very useful as a method of weight loss, but choosing your patient very carefully, explaining them all the risks and the benefits involved, screening them for any pre-existing pancreatic issue, any in children, we don't have diabetic retinopathy, but in adults, that's a prerequisite to screen them for that. And then start with the lowest dose and increase it gradually on a monthly basis. So this does give a very good response. But again, it is just a stopgap. It is not the ultimate answer to obesity. This helps you to get little more motivated, because when you lose that weight, then you have motivated enough to continue to maintain that weight. So this has to be, or any other pharmacological intervention has to be hand in hand with your lifestyle modification measures. Otherwise, there is no end point of till when we can give these drugs. And finally, the role of bariatric surgery. Now, with the advent of GLP-1 agonists, they are giving a result almost equivalent to that of bariatric surgery in adults. We do not have so much data for adolescents. And also, I must tell you that in India, these GLP-1 agonists are not licensed for children less than 18 years of age. However, in the US and in Europe, they are licensed above 12 years of age. So on an individual basis, using your own discretion, it can be used in the hands of a pediatric endocrinologist for adolescents. Bariatric surgery, again, before these GLP-1 agonists were available, it was the last resort for patients who were morbidly obese along with severe comorbidities. Earlier, the prerequisite was that the puberty should be completed and the final adult height should have been reached. But now, the latest guidelines of 2024 say that that is not a prerequisite. It can be done without that also. There needs to be extreme obesity and comorbidities which are persisting despite intensive 6-month diet and lifestyle modification, with severe psychological distress, and the patient has to be ready for a lifelong strict dietary lifestyle principles post surgery. So mentally he or she should be strong enough to adhere to this later. So this evaluation is also done before bariatric surgery, and of course it's very important that it is done in the right hands by the right person in the right center. There are multiple types of bariatric surgery. I will not go into that details on this forum. And finally, the future is about fecal microbiota transplantation. As I told you, that it is the gut microbiome which plays a very major role in the development of obesity. So there are a lot of studies and research going on that this may be available in the future. Fecal microbiota transplant taken from healthy, non-obese individuals. Of course, it's not, it's still in the research process, but there are studies which have been published showing good results. So we may be looking forward to this in the future. Thank you. Stop share.
Thank you, ma'am, for this informative session and the wonderful slides. Now I welcome Dr. Jyoti. Will speak on pediatric obesity.
Good afternoon, and thank you, Dr. Lalit, to introducing me to IPA. For the first time, I'm in touch with you for this session. So let me share my slides. So is it visible? The slides are visible? Dr. Lalit?
Yes, it's visible, ma'am. Please go ahead.
So we can go
Full
ahead.
screen, full screen. Do it full screen.
Yes,
So we need to start healthy since the beginning, the moment a child is born. So we normally advise that 6 month exclusively breastfeeding, and then the infant can put on a weaning diet by introducing healthy things like we can start with some lentils initially, egg yolk, then we can switch over to healthy fats with a little desi ghee and butter. We must avoid salt and sugar on initial days till the age of 1, and gradually we can as the child is progressing and the moment the child is around 1 year, so we can start a day pattern what an adult eats, like a 3 basic meal along with 2 small mini snack meals. And that too, when we give those meals, we should focus on proteins and carb balance. Fat invariably comes in the diet as it is. So if we talk of a healthy fat, we can introduce nut powder to the kids, and then we can add some MCT oil based food also if we give, if the child is underweight, because when we talk of a healthy start, we need to see if the child is underweight or overweight, both are not good. So today, as we are talking about obesity, childhood obesity, so let's focus on that. So we know what is health, and we know as per the WHO guidelines, health is the state of complete physical, mental, and social well-being, not merely an absence of disease or infirmity. So what we need to see is, as we started with infancy, so we will cover the childhood and adolescence age. So let's start with Healthy Start for Life. So 3 to 5 year is the age group which is very crucial for the long-term growth and development. There we need to see that what we are introducing to our child, what food they are they must add in their diet. So we see that we take the genetics from our parents, but we need to see the growth over the period of time, and then with the help of pediatrician, we know as per the growth chart what can be what is the status of my child. Is there any disease? Because if we don't follow that, then there can be some problems. So when it comes to preschooler, the appetite varies. They decide like how much to eat and all. So when when I go to schools and all, the normal problem is my child is mostly drinking milk, not eating much, because they have not taught during the initial days when they were infant that what small meals are very, very important initial ages to for the taste buds to develop. So we need to provide a variety of nutritious food to promote the and support the normal growth and health. We need to, as Dr. Manpreet very rightly told, that we introduce television and computers. When the child is not eating, parents sit with these screens with the kids, and their child is watching it, and their mother and the father or the grandparents are feeding the child. So that is the worst part to do. So we need to be a good role model in front of our kids. So we must sit on a dining table with them, or you know whatever the meal is there. Firstly, it should be a home cooked meal. Then a combination of dal, sabzi, dahi, roti. What a traditional Indian plate carries, we must follow in initial days so that the child also learn to develop such eating habits. So initial days, if the child is eating well, it will support the physical health, their brain development, daily activities, their sports performances, and prevention of diseases, which Dr. Manpreet very clearly said. A diet for the child also, we believe that it's like for adults like us, we must follow the same food pyramid pattern, the combination of cereal, milk, meat, legumes, green leafy vegetables, fruits, and least is our fats and oils. So if we talk of the healthy plate, so our plate should consist of a carbohydrate. For example, these days we are more into multi-grains and the role of ragi and bajra and all, and because they are rich in antioxidant and all has come. So we need to increase the dietary fiber, which acts as a prebiotic also. Here we were talking about gut microbiome. So if we give a healthy fiber, it will help on giving us a healthy gut microbiome. And then we need to focus on our proteins, which is very important in whether it's a childhood or whether it's adulthood. So we must focus on protein by having for a child between 3 to 5 age group, around 500 ml of milk and milk products are needed for a day, because if we give too much of milk, there would be less iron absorption, which again impacts the health. Then carbohydrates can be given in the form of multigrains or rice and chapati, avoiding the simple starches in the diet. So macronutrients like carbs, fats, and proteins, invariably we are supposed to eat. Protein, of course, we know for the muscle repair and the bodybuilding. So we need to show all these, when the child sits with us, we need to tell them these things are very important so that we can avoid getting the obesity. If we are ourselves having a plate full of carbohydrates, the child will be following the same pattern. So first we need to correct our house practices, what we are following. So fats are essential, and it helps in absorption of vitamin A, D, E, K. But we need to tell them these things are just not in a limited amount. If we have, we must avoid the saturated fats in our diet. But desi ghee, if we have a combination of desi ghee, mustard oil, and a refined oil on daily basis, we get healthy fats. We must focus on iron the moment we are touching adolescence, because especially the girl child, the needs are more. We can introduce in a simple forms to them, like, mint chutney is very good. We can add a little tamarind, which is again a good source. So we must focus on iron, zinc, and calcium in the early stages. We know that the children are very fussy eaters. So, and we know these junk foods are easily available to them. So first of all, we need to, delete Zomato and Swiggy from our phones as parents. And whenever we have to go to the market to pick up some stuff, we should, take steps, as Dr. Manpreet also suggested. So these are the simple things which we can follow. When it comes to junk food, we can make interesting recipes from our home items available to us. So rather the burger and all, we can, or a pizza, we can have, homemade chapatis, and we can use some vegetables and cottage cheese so that we get protein from our diet. So add simple things rather frying and all. We can use grilling. We can use grilling or shallow frying if we have to give something interesting to the child. So as I was saying, that milk, of course, is a complete source of protein and good source of calcium and vitamins, but not more than 2 glasses a day is recommended, so that it helps in building the bones and teeth. But it's a poor source of protein, so it can cause anemia to the adolescent kids. So a diet needs to, a well-balanced diet, if we focus on like iron, zinc, iodine, and calcium, along with vitamin D, folic acid, and vitamin B12 foods, which if we add in the diet. So if we eat a well-balanced meal, these all nutrients invariably we get from our daily diet, what we have. So when it's not important that we just need to eat at a regular intervals, that it's a breakfast, lunch, or dinner. So the moment a child is hungry, only then they should be eating, of course, following the pattern. But the moment since we need to control the portion size. So when the child feels full, we must stop it. We should not force the child, because then if we are forcing the child, we are adding extra calories to them. And we must avoid the junk foods. So what we need to do is we need to maintain the healthy hygienic habits, eat slowly. We need to tell the child to chew it properly, and they should not gulp it down. They must avoid the screen time, small frequent meals, so that they don't eat something wrong. And if we talk about snacks, we can eat. We can introduce nuts and makhanas, and we can give some beetroot snacks and spinach snacks to them. We can make crisp out of it at home. So food which are high in calorie, fat, sodium, and low in fiber, which causes obesity, hypertension, heart disease, and diabetes. We need to stop these foods. We need to tell the child by showing the pictures that these foods are, causing these problems. So they correlate the thing, and we can motivate them not to add these things. And we should not offer, if they achieve something, we should not offer sweet to them all the time. So this is like adding extra calories to them. So snacks like fruits, sprouts, beans, nuts, which are nutritious, can be given. Aerated drinks should be banned in the house, because these drinks and junk food are empty calories, which are high in sugar. So low calorie desserts, like, when we make custards or a dessert, we can add fruits or dates in it, so that we are adding some sweet to that. And these are low in calories. So physical activity is very, very important. So every day we suggest 1 hour physical activity apart from the regular thing. So whether it can be swimming or running or jogging, or I simply say if a child enjoys dancing, so they can, 1 hour dancing is again a very good physical activity. So thank you. if you have any questions, we are open to it.
Thank you, Dr. Jyoti, for a very well informative talk. And I have with us Shri Brij Bilas Rai. Brij sir, are you there? Hello? Hello? Brij sir, can you unmute yourself? Hello?
Sir,
Sir.
can you hear me?
Yes, sir. I can hear you. We are very privileged to have Shri Brij Bilas Rai, sir. He is a short introduction. He is a very well known in yogic sciences, and he is a founder of Shivoham Dhyanpit. And his trust is promoting holistic health, wellness, yoga, and meditation. And he is a certified yoga teacher and evaluator from the Ministry of Ayush Government of India. He holds a master degree in yogic sciences and he's a master's in alternative medicine. He is associated with Bihar School of Yoga, and he regularly conducts health related sessions and workshops, and he is into corporate management workshops and involved with a lot of multinational companies, workshops, NGOs, and government bodies. So the sir has been teaching selflessly without any economic interest. I think there are so many students are there associated with him. There are so many groups I have seen, and I have been associated with him for past 3 or 4 years. So I know that he is a man who can contribute, and he is contributing a lot towards the wellness and health in the country. सर आपका बहुत बहुत स्वागत है। मैं चाहूंगा कि आप जैसे अब हम बात कर रहे हैं ओबेसिटी की और अपने देश में बच्चों की ओबेसिटी कैसे रोक सकते हैं, तो आपका काफी अनुभव रहा है इस विषय के ऊपर। तो आप कुछ इस पे थोड़ा सा हमें बताएं कि किस तरीके से हम बच्चों को और योगा के द्वारा या किसी तरीके से किस तरीके से आप अपना जो अनुभव है हमें बताएं, शेयर करें सर।
Thank you, Dr. Puneet, sir. Thank you, IAP team, Delhi. IAP इस दिल्ली टीम पिछले कुछ वर्षों से डॉक्टर पुनीत शर्मा अपने संपर्क में है और उन्होंने मुझे यह अवसर दिया अपनी बातों को आप सबके समक्ष रखने के लिए। इसके लिए मैं डॉक्टर साहब का हृदय से धन्यवाद व्यक्त करता हूं, क्योंकि मैं सुन रहा था यू ऑल आर वेरी हाईली क्वालिफाइड पेडियाट्रिक सर्जन्स। बच्चों के क्षेत्र में किशोरों के लिए आप सब कार्य कर रहे हैं, अपनी अपनी सेवाओं को दे रहे हैं, और सेवाओं को देने के साथ साथ अवेयरनेस देना, क्योंकि योग में एक सूत्र कहा गया है अविद्या अस्मिता राग द्वेष अभिनिवेश पंच क्लेशः, क्योंकि जगत में सभी क्लेश का मूल अविद्या है। दैट इज अ रॉन्ग नॉलेज। सही ज्ञान का नहीं होना ही मूल कारण है अन्य सभी कारणों का। तो मानव देह मिला है या शरीर मिला है या सबसे बड़ी उत्तम कोटि की इस जगत की उपलब्धि है। इस धरा भूमि पर हम सबसे उत्तम कोटि के जीव हैं, क्रिएचर हैं, और उसमें भी जो बालपन है, किशोर अवस्था है, वह सबसे उत्तम समय होता है जीवन के उस काल में जो हमारे अंदर बीज और संस्कार पड़ जाते हैं, वही जीवन पर्यंत रहते हैं। डॉक्टर मनप्रीत सेठी, डॉक्टर ज्योति मैम ने इतने सुंदर तरीके से इस विषय को रखा, ओबेसिटी, मोटापा। अगर मुझसे पूछे कि मोटापा को आप व्याख्या करो, एक्सप्लेन करो, तो मैं तो कहूँगा कि यह मूल जननी है, माँ है, सभी रोगों की जननी है। डाइट के बारे में बहुत चर्चा सुनने को बहुत कुछ ज्ञान मिला। डेफिनेटली कॉम्बिनेशन ऑफ प्रोटीन्स, कार्ब्स, फैट्स, इन सब का हमें प्रॉपर तरीके से कॉम्बिनेशन बनाकर लेना चाहिए, जंक फूड से अवॉइड करना चाहिए। लेकिन एक बहुत बड़ा आहार जिस पर मैं ध्यान दिलाना चाहूंगा, हम सब आहार ग्रहण करते हैं अपने कानों से, हम आहार लेते हैं अपने आंखों से, अपने सेंसेस से। और जैसा आहार अपने आंखों से लेते हैं, जैसा कानों से सुनते हैं, वही उस उम्र में हमारे आगे के जीवन का निर्माण करता है। बहुत बड़ी चर्चा स्क्रीन टाइम का कि हम लोगों ने सुना है, डॉक्टर ज्योति मैम ने भी, डॉक्टर सेठी मैम ने भी हम सबको बच्चों के बारे में बताया। क्योंकि मात्र इतना बड़ा यह प्रकल्प आपने वेबिनार आयोजन किया है, ये छोटी बात नहीं है, ये बहुत बड़ी बात है। कुछ पेरेंट्स के अंदर भी, बच्चों के अंदर ये परिवर्तन हो जाए। क्योंकि मेरा तो यह मूड था कि हम लोग सूर्य नमस्कार साथ में करें। सूर्य नमस्कार, मैं आपको अपने परम पूज्य गुरुदेव की एक छोटी सी वाक्या को यहाँ पे कह करके फिर बात को आगे करूंगा। परम पूज्य गुरुदेव स्वामी निरंजनानंद सरस्वती, आप यूट्यूब पे सर्च करिएगा, स्वामी निरंजनानंद सरस्वती, भारत सरकार के पद्मश्री अवार्ड से उनको अलंकृत किया गया है। दुनिया भर में 16 भाषाओं के ज्ञाता हैं, लेकिन कोई स्कूलिंग नहीं हुई, कोई स्कूलिंग नहीं हुई सर। स्वामी जी अपने परम गुरुदेव स्वामी सत्यानंद के पास 6 वर्ष की आयु में आ गए और दुनिया भर में उन्होंने योग को लेकर के गुरु के साथ साथ घूमते रहे। और योग निद्रा के माध्यम से, मैं योग निद्रा को यहाँ डिफाइन कर रहा हूँ, कोड कर रहा हूँ, योग निद्रा एक स्लीप की बात, स्लीपनेपिया की बात हुई है, निद्रा की, सम्यक निद्रा, क्योंकि एक निद्रा की बात इंपॉर्टेंट है। सम्यक आहार विहार आचार विचार, सम्यक निद्रा, उस योग निद्रा के माध्यम से उन्होंने सब कुछ फिल्टर किया अपने शिष्य स्वामी निरंजनानंद के अंदर। मेरे कहने का तात्पर्य यह है कि सम्यक जीवन शैली, और जीवन शैली माता पिता से बनता है। माता पिता वह गुण डालते हैं अपने बच्चे के अंदर। इसलिए परम पूज्य गुरुदेव सबसे पहले कहते हैं कि प्रातः काल उठते ही महामृत्युंजय मंत्र, बहुत ही अटपटी सी बात इस वेबिनार में लगेगी आपको, महामृत्युंजय मंत्र किसी धर्म, किसी उसका वह एक मंत्र नहीं है। ओम त्र्यंबकम यजामहे सुगंधिम पुष्टिवर्धनम उर्वारुकमिव बंधनात् मृत्योर्मुक्षीयमामृतात्। बच्चों के लिए महामृत्युंजय मंत्र, फिजिकल फिटनेस के लिए, आरोग्यता के लिए परम पूज्य गुरुदेव ने, और गायत्री मंत्र विजडम के लिए, ज्ञान के लिए, नॉलेज के लिए। इन 2 मंत्र, मात्र 2 मंत्र, और सूर्य नमस्कार, मात्र 3 बात मैं कहूं करके अपनी बात को विराम दूंगा। समय की सीमा है, मुझे समय कभी और किसी और संदर्भ में मिलेगा। तो महामृत्युंजय मंत्र और दूसरा गायत्री मंत्र, ओम भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो नः प्रचोदयात्। गायत्री मंत्र प्रेयर है, प्रार्थना है, हमारी बुद्धि हमारी निर्मल हो, सुमति हो, उत्तम बुद्धि हो, ज्ञान सद्ज्ञान हो। क्योंकि हम सभी माता पिता अपने बच्चों को ज्ञान, पढ़ ले ज्ञान देने में मशगूल हैं। ये एग्जाम क्वालिफाई कर ले, इतने परसेंटाइल चाहिए। आईक्यू पे बहुत फोकस है, ईक्यू, इमोशनल क्यूसेंट की मिसिंग है सर। हमें बच्चों के साथ मिलना पड़ेगा, जुड़ना पड़ेगा, एक होना पड़ेगा। और जितना बच्चे के साथ, परिवार के साथ वो बच्चा रहेगा, अपने दादा दादी के साथ, नाना नानी के साथ, बूढ़े लोगों के साथ, बुजुर्गों के साथ अपने संबंधों को समझेगा, उतना ही उसके अंदर एक संस्कार का बीज रोपित होगा। और जब संस्कार का बीज रोपित होगा, तो आप यकीन करिए, दादा दादी के साथ हंसेगा, दौड़ेगा, खेलेगा, कूदेगा। ओबेसिटी का कोई रीजन नहीं है। अभी तो कहा मैम ने, ज्योति मैम ने, बच्चा डांस करे, उसका आहार, उसका विहार हो गया, विहार, रिक्रेशन, दैट इज कॉल्ड रिक्रेशन। एक कमरे को बंद कर ले और नाच करके लथपथ हो जाए, सारे हार्मोन्स जो है उसके बैलेंस हो गए। सूर्य नमस्कार के 12 पोस्चर के अभ्यास करने से जो भी ग्लैंडुलर एब्नॉर्मलिटी है, आपके हार्मोनल इम्बैलेंस है बच्चे के अंदर, क्योंकि 656 मसल्स, मांसपेशियों की टोनिंग होती है मात्र एक सूर्य नमस्कार के अभ्यास करने से। मैं अन्य आसनों में नहीं जाऊंगा, क्योंकि ताड़ासन है, त्रिकोणासन है, कटिचक्रासन है, भुजंगासन है, लेकिन मात्र सूर्य नमस्कार की बात करूं। सूर्य नमस्कार के 12 पोस्चर अपने बच्चों से जरूर कराइए, अपने साथ, उनको साथ। और अगर बच्चा नहीं करता है तो जबरदस्ती मत करिए, धीरे 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 सहयोग करिए, उसके साथ जुड़िए। और जैसा कि डॉक्टर साहब ने बताया, शिवहम ध्यान पीठ का एक प्रकल्प है, बाल निर्माण से राष्ट्र निर्माण। हर एक रविवार को, एवरी संडे 9:30 to 10:30 बच्चों के लिए योग का क्लास, योग की कक्षा होती है। उस कक्षा वह निःशुल्क होती है। पूरे देश भर से, विभिन्न प्रांतों से बच्चे जुड़ते हैं और योग के साथ साथ उनको और भी एक्टिविटीज उनको कराई जाती है, वो भी एक्सपर्ट टीचर्स के माध्यम से, उनके सेवा के द्वारा। यह पूरा प्रकल्प निःशुल्क है। तो मैं अपनी बातों को यहीं पे विराम दूंगा, क्योंकि समय की सीमा है। डॉक्टर साहब, आप सभी का पुनः बहुत बहुत धन्यवाद। किसी और मौके पर लंबी चर्चा होगी, इसलिए वजन को नियंत्रित करना है, ध्यान में भ्रामरी प्राणायाम का अभ्यास करना है, ओम चैंटिंग करना है, इससे एकाग्रता बढ़ेगी बच्चे का जो डिस्ट्रैक्शन है, इतना सारा डिस्ट्रैक्शन का पूरा फील्ड तैयार है। उसकी शुरुआत होगी सबसे पहले माता पिता से, उसके बीज हम सब डालेंगे, हम सब मिलकर। आप सभी के कोई प्रश्न होंगे, उसके लिए मैं प्रयास करूंगा। मुझे आज बहुत कुछ सीखने को मिला, इसके लिए मैं डॉक्टर पुनीत शर्मा का हृदय से आभार व्यक्त करता हूँ। सर, धन्यवाद।
बहुत बहुत धन्यवाद सर, आपने जो हमारा मार्गदर्शन किया। आपका जो उद्देश्य है, बाल निर्माण से राष्ट्र निर्माण। हम जैसा खाते हैं, जैसा हमारा भोजन, वैसा जैसा तन वैसा मन। और जैसे आपने बताया, सम्यक आहार, विचार, विहार, आहार और निद्रा, और उसमें थोड़ा सा सूर्य नमस्कार और ये सब प्रतिदिन अगर थोड़ा थोड़ा करके कि हम पारिवारिक रूप में जोड़ पाए, तो ये मुझे लगता है कि बच्चे की IQ नहीं, EQ के लिए भी बहुत बड़ा डेवलपमेंट के लिए और ओबेसिटी के लिए आई थिंक काफी हद तक हम लोग उसमें सफल हो पाएंगे। इन सब के लिए बहुत बहुत धन्यवाद। अब मैं आगे आमंत्रित करूंगा, रिक्वेस्ट सी जयपाल कपूर सर। सर, आर यू अवेलेबल सर? JP कपूर सर।
Yes, sir, I'm there for your kind help.
हाँ
बताइए सर।
सर का बहुत has been a lot of experience working with the government schools and various capacities. Sir, can you just share your experience, like how can we prevent, and what you did in your time and what we can do right now for prevention of obesity in our children in clinics, as well as when we are propagating to their parents also? Please, sir.
Thank you, Dr. Puneet Sharma, for calling me. First of all, happy Holi to all of you. And for this happy Holi, I have made this background. Let's make our plate colorful, as much colorful as possible on this Holi. That's the first solution for the exogenous obesity, which Dr. Manpreet Sethi has talked about. So if you make your food plate colorful with all the different colors of vegetables, fruits, different items, half of the things are sold out for the exogenous obesity, which we are talking about. Regarding your questions, what I have done as a head of the school health program, I'm at present, though I'm at the moment director and head of the Yashoda Pediatrics Department, I'm also working as a expert advisor to the WHO for the school health schemes, school health services. So what we have done is we realize that awareness only is not going to work. We need to work with the students, and we went into the issues why they're getting obese. As the data has been given by the Manpreet Sethi ji, we really wanted to know what can be the causes for this, and we found the main influence of the diet of a student is because of many reasons, and the most reason is the habits of the diet is shaped in the schools. The bartering happens in the schools. If the child carries some diet which is healthy, another child is carrying pizza, carrying burger, they get influenced by that. The school is one source where the habits are made. Other is in the family. What is family eating? If the family plate is healthy or not, that's very important. The social media is playing a big role. The type of advertising which we see all over the roads, streets about the various junk foods, I will call them junk food, over saturated foods, overcooked foods, ultra processed food, whatever you call them, and peer influence, aggressive marketing, all these issues are basically causing this shaping of the habits. So we need to work with the students, we need to work with the schools, to really change their habits. And we started doing that. And I'm really thankful to my Honorable Prime Minister Modi ji, who is one of the talks in the Man Ki Baat, he talked about obesity. He put the obesity into the main focus. This is an epidemic which we have to deal with. We have to have a good assets in the future. They are going to be our producers. Our productivity of the nation totally depends upon my adolescents. If they're going to be obese, their productivity is not going to rise. So he has made the obesity into the main focus. And for that matter, when I was in schools, you will agree with me, Dr. Puneet and rest of the people, it requires a lot of convergence with different ministries. It's just not Department of Health. It requires the help of Department of Education. It requires the help of Department of Women and Child Development and many other departments and ministries which have to come together for street children, for all the things. Because Poshan Abhiyan, he learned it, started the Poshan Abhiyan not only for obesity, for also the malnutrition. So many other ministries were conversed. They all were brought into one table to make a policy decisions. And these policies were so tight, he made that nobody in around the schools can sell the junk food. Neither in the canteen nor around the schools, junk food can be sold. About 100 meters, nothing can be sold about it. And along with that, we started peer educator approach, leadership. We have to bring adolescent forward. We have started this portion program in schools where we have created health champs who are also the knowing about everything about the healthy dietary habits. And believe me, we are taking classes on the life skills. You must have heard about 10 life skills. We have added one more life skills, which is food literacy. And what is food literacy life skills? Before you eat any food, a label is always been pasted over there on the food that has been made sure. I told you, many ministries. Here is the Ministry of FSSI, Ministry of Food and Nutrition brought into things so that each junk food has to put a label in front of it, how many calories, how many fat, how many proteins this food is carrying. And we have been putting this board into the schools that each school should teach the students that how to read this label and know what are they really eating about it. So that's the approach. The different ministries have come together. Women and Child Welfare Ministry is working with the children. School Health is working with the children to make them literate about the food literacy. But ultimately, what matters is the youth leadership. Our youth has to come forward. We have to create peer educators. I will really motivate all my IAP listeners. Please become the youth leaders. Go to the schools and motivate the students for this literacy of the food literacy so that each one of us knows what to eat and what not to eat. So these are the different actions which we have taken in the schools, and we really think IAP should come forward for active youth engagement. That's what my submission is. Thank you very much, Dr. Puneet. I won't go into further details. There are many things which we have done, but to keep the things brief, these are the basic policy decisions which we have taken, and they are getting implemented in the schools, sir. Thank you very much.
Thank you,
Dr.
sir. Dr. Manpreet wants to say something.
Yeah, Dr. JP Kapoor, I just wanted to add over here that maybe another initiative that we need to do with schools is that schools should stop sharing or giving any academic work through digital media. If they give it through
Right.
WhatsApp, through through Google Classrooms and all, parents are forced to give a handheld device to the child. This all started with COVID and it has not gone back. It's not just for obesity, for mental health also, for so many things. So
I
maybe
totally agree with you, Dr. Manpreet. Totally agree with you
should
that
be
even IAP has come out with screen guidelines, and we should follow these screen guidelines and tell our school students also to follow these guidelines. No, nothing on the digital media. You are right over there.
it will be like Scandinavian countries have gone back to pen paper. Nothing is there through it's all cyclostyle sheets and what used to be earlier.
Yeah, you're right over there. And the playing game shields. Another thing which we have done is that each class should have at least one period for taking the students into the field and make them play some game over there. That's another thing which we have done over there. This is the physical activity is as important as is making a healthy plate, colorful plate. We have to make them go to the fields.
Sir, can I add one more thing?
Sure, ma'am. Why not?
Yes, ma'am, please.
So, as promised, Dr. Manpreet said, no online classes and no homework on the phones. I want to add, every school must have a food committee. So that a dietitian is involved, a doctor is involved, and if the screening of for the obesity child is there, so that a nutritionist can intervene, and with the right guidance, we can stop the obesity. It will help to stop the obesity.
We have made a software, madam, where each child's anthropometry is taking, and I have attached a WHO chart. Automatically, the child's BMI, child's weight for age comes automatically. And if child is found to be obese, is referred to the counselor for further management. We have the schools have counselors, and they refer the patients, manage the patients accordingly, call their parents, and counsel them accordingly. But definitely, it can be expanded so that we can involve dietitians also into this. Some schools have dietitians, but most of them don't have it as far as government schools are concerned.
There is a one way forward can be. I was listening to at I think it was a WhatsApp forward only that there is some famous TV actress from Mumbai. उसके स्कूल में उसके बच्चे स्कूल में जाते हैं तो मान लो क्लास में 40 बच्चे हैं 40 बच्चे हैं तो 40 बच्चे के लिए हर माँ हर मदर जो है एक पेरेंट जो है एक दिन का खाना वो 40 बच्चों के लिए बनता है तो वो बनवाती है उस समय तो सारे बच्चे घर का होम कुक्ड फूड लेके आते हैं तो इस तरीके से अगर मान लो क्लास में 40 बच्चे 40वें दिन उसका पेरेंट का नंबर आएगा तो एक ये भी एक तरीका हो सकता है ये मुझे वाकई में अच्छा लगा कि ठीक है वो उसमें भी और दूसरी बात ये कि सारे बच्चे एक जैसा खाना खा रहे हैं उसमें ये नहीं कि इसके टिफिन में ये आ गया उसके टिफिन में वो आ गया कोई कुछ ले आया कोई कुछ ले आया तो ये भी एक मुझे लगता है कि एक स्कूल अपने लेवल पे एक ये भी एक छोटा सा एक्सपेरिमेंट करके देख सकते हैं
आइडिया मिड डे मील का आइडिया है एमडीएम के अंदर हम यही करते हैं जो गवर्नमेंट स्कूल्स के अंदर फॉर दैट इज फॉर बेसिकली फॉर अंडर न्यूट्रिशन school is cooking now the food inside the school. They have been provided grains, raw grains, and they cook the food. Definite amount of proteins, calories, fats have been decided. This much protein, this much calories, this will be provided to each child that day. So that's all a part of the Mr. Modi ji is doing about this. That MDM is also become a part of now Poshan Abhiyan, midday meal. So Poshan Abhiyan is a really good initiative which he has taken, sir. And all these things have been taken care of.
हाँ नहीं ये जो वो है वो तो आपने बताया ना गवर्नमेंट स्कूल्स का मैं प्राइवेट स्कूल्स की बात कर रहा था वहां पे ना ये चीज शायद अवेलेबल नहीं होती
So this is very difficult for opposition for private schools to cope with. कि बच्चे को कुछ भी अगर कोई बीमारी हो गई तो they will blame the school. Safety and security is also my prerogative and my responsibility of the school. That once child is in the school, he should be safe and so on. So this is we will talk some other day. How can we make the schools more safe and secure?
थैंक यू फॉर द योर इनपुट सर Now I have
Thank you.
Dr. Kishan Jani. Dr. Kishan Jani, sir, are you there? Kishan, sir, can you unmute, sir? Dr. Jani, sir, is he there? Dr. Fotedar, sir? Dr. Fotedar, Arun Fotedar, sir?
Yes, I am here, but I can't see.
Sir, welcome, sir. Sir is very passionate about the nutrition. And sir, will you please elaborate about the diet in infancy, starting
Dr.
from
Puneet,
the baby is born
I have
from
2
womb to
points to make
almost 1
here.
year, we can say up to the almost 2000 days, 1000 days almost.
And that I will be talking definitely, but I have 2 more points to make. First of all, that I would appreciate if every one of us, all pediatricians here, they start devoting a little bit of time about nutrition counseling in their outpatients. The time really devoted to nutrition in a general OPD setup is dismally less, and it is just treatments and go out. Second thing, I would like to appreciate one thing for most of the people in northern part of India, milk is being undue weightage, and particularly considering that some of the people, some of the patients who are coming to me, they are giving their children after 1 year when we tell them, okay, now you can take the milk which is being taken in their homes. So it is a pure buffalo's milk. Uska jo calorie content hai more than 100 per 100 ml है 117 के करीब. उसका फैट कंटेंट 7 grams है. उसका प्रोटीन कंटेंट जो है about 4 times है, and they are being given to them. Besides all the GMPs that are there, these GMPs are insulinogenic, and they generate a lot of insulin in the body, and at the same time insulin sends the whole glucose into the fat. They become fatty and at the same time hungry. A cow's calf gains doubles his weight by about 2 months, but human baby doubles his weight around 4 months. There is a physiological difference. So cow's milk is not good for us. Besides, कैल्शियम एंड फॉस्फोरस के बारे में बातचीत होती है. कैल्शियम एंड फॉस्फोरस इज यूबिक्यूटस, हर खाने के अंदर है. आफ्टर ऑल, गाय जो दूध में कैल्शियम डाल के देती है वो कौन सा दूध पीती है? वो भी तो कोई दूध नहीं पीती है, ठीक है ना. सो वी हैव टू बी ए लिटिल pragmatic about how much milk we advise our children. Now I come to these things that in the first 1,000 days, as amply pointed out by my co-colleagues, Dr. Manpreet B और Madam B, कि भाई हमें पूरी की पूरी डाइवर्स जो है प्रोटीन्स, फैट्स एंड कार्ब्स जो हैं, उसमें से कार्ब्स को रेस्ट्रिक्ट करके एसेंशियल फैटी एसिड्स फॉर गिविंग द राइट काइंड ऑफ फैट्स, एट द सेम टाइम जो प्रोटीन्स हमें देने हैं, दे शुड बी द गुड क्वालिटी प्रोटीन्स. And I need not reiterate this thing कि we have not to introduce these junk foods to the children, and we have not to bribe the children. Bribing होती है, बच्चे तुमने ये कर लिया तो तुम्हें हम अंकल चिप्स ला देंगे, तुमने वो कर दिया तो हम तुमको चॉकलेट ला देंगे. Instead, start bribing them with games, outdoor games. तुमको वहाँ ले जाएंगे, तुमको ऐसा ले जाएंगे. These are the things that we have to give. So that is where we have to be very particular about it. Then another aspect of it is our hidden hunger. How much are we working on the hidden hunger part of it? And as Dr. Manpreet also and Dr. JP Kapoor also and Madam also, she has just now said कि भाई कितना बड़ा platter है. There are supposed to be about 7 different kinds of food groups, and it is recommended जो in infant and young child feeding practices की जो recommendations हैं, they say that at least 4 of the groups should be represented in daily diet, preferably 5. Or whenever we are talking to the parents, we never identify these things. We just them अच्छा खाना दे दो, balanced खाना दे दो. Does the mother understand what balanced खाना is? We have to spend some time on that, and we have to tell them कि balanced खाना क्या होता है. And then at the same time, as Dr. Manpreet told this thing, we have to project it to them कि भाई तेरे बच्चे का फ्यूचर ये है. तेरा मोटा बच्चा जो है उसके बाद में उसके घुटनों में दर्द होगा, उसको हार्ट डिजीज होगी, उसको डायबिटीज होगी, उसको एक हीन भावना आएगी, वो अपनी क्लास में जोकर बन के रह जाएगा अटेंशन सीक करता हुआ. So these are the things that we have to talk about. I think we can talk about the obesity for lengths together, and all of us have done and talked about it. It has been a wonderful program. Thank you, Puneet, for giving me an opportunity to say all these things. Thank you.
Thank you very much, sir. I have Dr. Jani, sir. Dr. Jani, can you please elaborate on some adolescent health? Dr. Jani, I think is he there?
I think he's not
Regulate?
here. He's not here, sir. I think he's left.
Okay, he is left.
No, he's left.
So I think the session is open for question and answer from the participants. So please unmute yourself and you can ask whatever you want to ask about this obesity and the related things. Are there any questions in the chat box?
So there is no question, I think. No question in the chat box.
ओबेसिटी ये किसमें एक ही लिखा हुआ है, हाउ टू ईट सलाद। बच्चों के लिए कई बार सलाद खाना बड़ा मुश्किल होता है, वो सब ग्रीन लीव्स होती हैं, ये सब होता है। बस एक क्वेश्चन मेरे को दिख रहा है यहाँ पे, है ना।
तो
तो
सैलेड्स की ना, अच्छे सैलेड्स के बहुत अच्छे अच्छे बच्चों के लिए ना, वी कैन कट द शेप्स इनटू सैलेड्स के लिए, सो दैट फैंटासाइजेस द किड्स, सो उस फॉर्म में खा लेते हैं। या स्टीम करके ब्रोकली वगैरह का है, छोटे बच्चों को तो वी कैन मेक अ प्यूरी एंड गिव इट टू देम। जो टॉडलर्स हैं हमारे, तो उनको प्यूरी फॉर्म में दे सकते हैं। बड़े बच्चों के लिए नाइस शेप्स के साथ वी कैन कट एंड गिव इट टू देम।
Can also grate the vegetable and put it in the atta or in the dal or whatever you're doing. But then again, you're teaching the child it's okay that you're not eating vegetable. The idea is to teach the child that you should eat. So what I do is I get sometimes very fussy children. So I speak with them. I mention all the names of the vegetables and all. I say choose one. एक choose कर लो, कोई भी एक choose कर लो, और आप वो एक vegetable once a week or twice a week आप खाओ. And then you extend the palate. So you have to, you cannot escape, like hide करके नहीं करना, सामने करके करना. Food should be, it should be very important for them कि वो क्या कर रहे हैं, क्या खा रहे हैं. And it should be
another easy way for the kids is, वो parents भी क्या करते हैं, fruit नहीं खाता बच्चा तो फटाफट से juice बना के दे दिया. So that again, they're just, pumping fructose to them. So that again is not a very good thing. So it's better, fruit खाना, धीरे धीरे वो taste उसको develop होगा.
The parents have to model it also.
Yeah.
That can be hard.
And grandparents, like, in the OPDs also, parents come to us and they say कि हमारा बच्चा रोटी नहीं खाता है, खाना खाया तो बहुत थोड़ा खाया. So what the grandparents or the parents are feeding, chocolate खा लिया बच्चे ने, तो एक chocolate खा के उसको भूख नहीं लगेगी. That is understood.
Yeah.
So वो पैकेट चिप्स का खा लेगा तो उसको कैलोरीज कहीं ना कहीं से वो मिल गया, उसका एनर्जी स्टोर चला गया बॉडी के अंदर. So यहाँ पे हमें पैक्ड फूड को रोकना है, फ्रूट्स एंड सैलेड्स को ज्यादा इंट्रोड्यूस करना है, देन दे विल लर्न टू ईट.
So
बहुत ही कॉमन प्रॉब्लम है कि वो
environmental modification, basically out of sight, out of mind. You don't keep it, they will not ask for it. I'm talking of older children. So that is the best way. You don't keep, आपके घर में बिस्किट्स नहीं है, चिप्स नहीं है, गेस्ट आएंगे, हम क्या देंगे, वही दो जो आप खाओगे. Give मखाना.
हाँ, एग्जैक्टली. नट्स दो, मखाना दो, सीड्स आर अवेलेबल. आप घर पे ही हेल्दी क्रैकर्स जैसे फ्रूट के हैं, सो आप जो है चिप्स बना सकते हो इन्हीं चीजों के. आप जैसे कमल ककड़ी है, उसको ग्रेट करके एयर फ्रायर में उसको चिप्स के फॉर्म में बना के दीज हेल्दी स्नैक्स यू कैन कीप. वो धीरे धीरे टेस्ट डेवलप हो जाता है बच्चों का.
So obesity के लिए Dr. Puneet, like Dr. Fotedar said, it's not a 5-minute, 10-minute consultation.
Yeah.
Proper sessions, and it has to cover all aspects. Maybe it's worthwhile, keeping one educator, which can be shared amongst pediatricians who has been trained very well and she or he can do OPD for a few hours at different places, and you can pool in your patients of obesity, club in, and make it, call them on those days and give them that time. There is no shortcut to time. There's no shortcut to detail. There is no shortcut to explaining them all the benefits and risks, everything. So as detailed as possible, as much information. And I even give written handouts on different aspects, even aspects of how to motivate a child to lose weight. So written में.
मैडम हम लोग ओपीडी में तो चलो हम लोग ओबेसिटी BMI भी कैलकुलेट कर लेंगे, वो सब कर लेंगे. हालांकि आजकल तो सब एप्लीकेशन पे अवेलेबल है,
Yeah.
एक नॉर्मल पेरेंट कब आप आपके पास आए कि मेरा बच्चा मैडम मुझे मोटा लग रहा है, या फिर खाली मोटा दिखने में होना चाहिए, या फिर वो कब आए उसको, जो कि कोई ऐसा इंडिकेटर है
वो
वो?
इंडिकेटर अपने पियर्स के साथ ही पता चल जाता है ना। आजकल तो पियर्स भी मोटे हैं तो एक्चुअली पता नहीं चलता, बिकॉज द इंसिडेंस इज सो हाई। बट यूजुअली हाइट के लिए भी तो ऐसे ही आते हैं ना, कि दूसरे बच्चों के हिसाब से छोटे हैं। अब मोटे के दे डोंट इवन अप्रिशिएट, दे डोंट वांट टू अप्रिशिएट के बच्चा मोटा है। सो जो हमारे पास आते हैं, दे आर इन द ऑलरेडी इन द हायर ओबीस रेंज, दे डोंट कम इन द ओवरवेट रेंज, हाई ओबीस रेंज में। सो
एक सोसाइटी में एक और, कैन आई कम, सोसाइटी में एक बहुत बड़ा परेशानी है। हम लोग ये किसी भी बच्चे को, जो बच्चा ठीक भी होगा, ये नहीं कहना चाहता कि बच्चा ठीक है। हम घर जाएंगे किसी
कमजोर
के,
है,
उसको यही कहते हैं यार तेरा बच्चा तो बहुत पतला है,
कमजोर है।
कमजोर
I
लग रहा है।
started off with that slide.
और अगर मोटा कह दो तो नजर लगा रहा है, मेरे बच्चे को नजर लगा रहा है, इसको नहीं दिखा रहा लेके।
यस सर,
Dr. Pultega.
प्लीज गो अहेड फतेहदर सर।
I just wanted to add to Madam Jyoti's comment, and we can add a little bit of lemon juice and some spices to all these salads, grate karke, and I have eaten it myself also. Those things, they become really palatable, and this is the art with our nutritionists and our dietitians. They can do it so beautifully. All that needs to be done is to be told to the mother to do it this way, and they will do it, and the children like it that way. I have converted so many children into non-fiber eaters to fiber eaters myself. Lemon will also help them in absorbing more iron in that.
So these days, I was saying कि children are more into, momos खाना है, ये खाना है. So I have small daughters at home, so I made roti. उसी रोटी को ही मैंने जो सब्जी बना था वो भर के मोमोज बना के दे दिया कि खा लो. So you have to be really innovative with the kids.
Yes, yes.
Again, with working parents, it becomes very difficult. Dada dadi
I am.
nahi hote.
Yeah.
I'm telling you, and helps are not that. So if you have good helps and you can just fast forward, I mean, just
Yeah.
forward a YouTube video every day. Ye interesting khana, ye interest. I mean, I do that. Because thanks to this, I mean, there is some benefit of living in this digital.
Absolutely, yeah.
There is so much variety of interesting, tasty, nutritious food. You just have to take. So I tell my parents, patients that Sunday को बैठो, सारे लोग बैठो साथ में, family के सारे लोग, और एक food timetable बनाओ and make it
Right.
for all your meals and your snacks. Make sure you're incorporating different varieties, and also you're taking in the child's dislikes and likes. Just use the right and healthy ingredients. Our children are exposed to world cuisines. वो रोटी दाल सब्जी ये सिर्फ ये नहीं खाएंगे, उनको ये मोमो भी चाहिए, उनको पिज्जा भी चाहिए. Make sure you can make that variety at home. Be pre-planned. If you want, already put the link of the video on that thing and just, और अगर खुद बनाना है तो खुद बनाओ. Send. Lot of planning is needed. Creativity is needed. Lot of time is needed.
Sir, Dr. Kishan, Jani sir, I think Dr. Jani has joined. Jani sir, please go ahead, sir.
आवाज आ रही है?
आ रही है सर, आ रही है, बहुत अच्छी आ रही है
आवाज.
जी सर.
थैंक यू. बस मुझे सिर्फ इतना कहना है कि एडिपोसाइट्स जब बन जाते हैं तो उनकी मेमोरी 10 इयर्स की होती है. तो वंस पर्सन हैज बिकम ओबीज और इफ इट ट्राइज टू थिन डाउन, then he'll have to continue his effort for at least 10 years
Yeah.
to remain thin. Otherwise, he will regain weight soon.
Very quickly.
तो ये बात
Very
Very-
right sir.
ये अगर आपको मरीज पेशेंट, तो अगर ये सारी जाए ना कि अगर हो गया मोटा तो फिर 10 साल तक लगे रहोगे, तब भी ये पतला नहीं होने वाला दोबारा. और ये जरा सा भी चूक होगी.
Right sir, right. Thank you sir. I think there are there any other questions, Dr. Lalit? अच्छा, लास्ट में मैं एक चीज पूछना चाहूंगा. आई थिंक मोस्ट ऑफ द क्वेश्चंस हैव बीन आंसर्ड इन द स्लाइड्स इटसेल्फ. ये हर्बल रेमेडीज का क्या रोल है? बहुत सारे लोग अपना ग्रीन टी और वो सब घोट घोट के पीते हैं. बाजार में भी खूब सारी मिलती है, कैप्सूल भी मिलते हैं, और कुछ एक तो आयुर्वेदिक रेमेडीज भी बोलते हैं इसको. तो वो डॉक्टर ज्योति, डॉक्टर
Marketing
मनप्रीत,
gimmicks.
योर टेक प्लीज.
Sir, ग्रीन टी अगर ले रहे हैं तो वो आता है कि गर्म पानी या नींबू के साथ भी अगर ले रहे हैं तो मेटाबॉलिज्म बूस्ट करने के लिए। सो द की एक्चुअली इज अ हेल्दी वेल बैलेंस्ड मील, जो एक इंडियन खाना है विच इज अ वेल बैलेंस्ड मील। हाँ, अगर हम सिंपल स्टार्चेस लाइक मैदा, सूजी, अरहर, बिस्किट, ये सारी चीजें हटा दें, सिंपल जो इंडियन ट्रेडिशनल हमारा दाल, रोटी, सब्जी, दही है, दैट इज अ कंप्लीट मील, बट वी मस्ट फोकस ऑन प्रोटीन। तो पहला जो हम खाएं वो प्रोटीन को अगर खा रहे हैं अपने खाने में, पहले दाल खा रहे हैं या जो ब्रेकफास्ट लेते हैं अगर हम उसमें एग या मिल्क ले रहे हैं या हम स्प्राउट्स के साथ ले रहे हैं या कुछ बेसन की चीज ले रहे हैं, तो प्रोटीन जो है हर मील में हमारा फोकस होना चाहिए। और अगर हम वेल बैलेंस मील ले रहे हैं, हमें ये कुछ भी एक्स्ट्रा इस तरह की चीजों को लेने की जरूरत नहीं है। सिंपल भाषा में पेरेंट्स आते हैं कि क्या हम सप्लीमेंट्स दे रहे हैं बच्चों को, जरूरत नहीं है। अच्छा खाना खा रहा है, नट्स खा रहा है, फ्रूट्स वेजिटेबल्स खा रहा है, वी फोकस हर पेरेंट को कि कम से कम 500 ग्राम फ्रूट्स एंड वेजिटेबल खिलाना है बच्चे को। सो अगर इस तरीके से हम काउंसिल करते हैं, मोटिवेट, एंड देन यू नीड टू आस्क द चाइल्ड आपको कौन सी सब्जी पसंद है, क्या पसंद है, एंड यू गिव देम द मॉडिफिकेशंस, लाइक यू नो डॉक्टर मनप्रीत सेड प्यूरे करके आटे में गूंद के दे दो। बट हर टाइम के लिए वो सोल्यूशन नहीं है। जब कभी मन नहीं है तब हम खा सकते हैं, बट वो टेस्ट डेवलप तभी होगा जब खाएंगे। वो बच्चे को नहीं खाएगा, एक दिन नहीं खाएगा, 2 दिन नहीं खाएगा। वी वर टॉट लाइक दिस, ये खाना है, सुबह बनाए यही खाना है, लंच बनाए यही। आई नो दैट वी वर बॉर्न एंड बॉटम, हम भी फंसी थे अपने टाइम में। सो वी क्रॉस दैट फेज। सो सेम वे द रूल इज सेम इन माई हाउस ऑल्सो, कि ये है, ये खाना है, सबने खाना है। जो चीज पसंद नहीं है उसको पहले खा लो। दोनों चीज बनेगी, एक जो अच्छा नहीं लगता है बच्चे को बोलना है ये भी बनेगा और ये भी बनेगा। जो पसंद नहीं है पहले खा लो, दूसरी जो अच्छी चीज है वो बाद में खाओ, सो दैट यू लीव योर टेस्ट बड्स यू नो एट योर मेंटल सेटिस्फैक्शन। सो वो हमें काउंसिल करना है, बच्चे को मोटिवेट करना है। वी नीड टू अंडरस्टैंड द चाइल्ड और उसको उस हिसाब से रेसिपीज बना के देनी है। एंड दे लर्न द चाइल्ड। इफ कुछ होते हैं जो बहुत ज्यादा फसी होते हैं, then they need a psychiatric consult. At times I have sent the my obese kids patients जो है मेरे, उनको मैंने भेजा है। they need those counselings, जो वो फंस में आ जाते हैं, बट मोस्टली बच्चे समझ जाते हैं मोर और लेस। तो वो थोड़ा कहीं ना कहीं एज अ न्यूट्रिशनिस्ट और डॉक्टर, पीडियाट्रिशियन और पेरेंट्स के साथ मिलके, जैसे डॉक्टर मनप्रीत ने कहा, एक चार्ट हमें खुद ही बनाना है घर पे। आई टेल माई जो बच्चे आते हैं कि आप खाना खाओगे ना, आपको गलत नहीं करना है। आप जैसे होमवर्क आपको स्कूल से मिलता है, तो आप एक फूड डायरी मेंटेन करो घर पे कि आपने क्या खाया आज, आपने क्या क्या एक्टिविटीज की, डिड यू प्ले फॉर 1 आवर, आपने इनटेक क्या था आपकी डाइट का, क्या कम खाया। सो आपको पता है आप कहाँ गलत जा रहे हो, एंड देन नेक्स्ट डे यू नो यू करेक्ट योर सेल्फ। वो खुद से करना शुरू करता है तो उसका जो कॉन्फिडेंस लेवल है वो बढ़ता है। सो वी नीड टू यू नो टेक स्मॉल स्मॉल स्टेप्स व्हेन दे कीप कमिंग टू अस कि अच्छा ये किया ये किया, they learn very easily.
Right, ma'am. My main question, that's all right. हाँ,
So,
कि ये जो हर्बल रेमेडीज होती हैं, पहले तो खूब सारी एडवर्टीजमेंट होती है, बट हाउ सेफ आर दे?
so I'll tell Dr. Puneet. So, ये nutraceutical industry, it's $1 trillion industry which is feeding on our fears and our desperation. There is no clear-cut benefit of any of this. In fact, there could be harm. If you've heard of Herbalife, these shakes and all that they produce, there are 50 reported cases of toxic liver injuries in that. So they do contain an excess amounts of even green tea, black cohosh, and sometimes these things, they contain sibutramine, they contain ephedrine. So cardiac side effects, liver toxicities, all are there. And when we talk about the benefits, तो बेनिफिट क्यों कर रहे हैं? बिकॉज यू आर रिप्लेसिंग अ मील विद अ शेक। तो ऑब्वियसली आपकी कंटेंट, कैलोरी कंटेंट सब कुछ कम हो गई, आपने वो कम करके, एंड दे हैव एडवर्टाइज्ड इट कि इस शेक से वेट लॉस हो रहा है। उस शेक से वेट लॉस नहीं हो रहा है, उसका आपका एक मील का कैलोरीज के बदले में आपने वो शेक ले लिया। अगर आप नॉर्मल प्रॉपरली खा रहे हो, सारे कैलोरीज खा रहे हो, और आप ग्रीन टी सिर्फ अब्जॉर्प्शन के लिए ले रहे हो, कुछ नहीं होता। देर इज नो there is no role of, if you are not going to limit your diet properly and your lifestyle, and you're only going to rely on these herbal supplements, no role at all, and in fact dangerous, specifically from the point of view of cardiac and liver toxicities.
Yes, very well said. There is no role as such of these highly, they're more of like they are hepatotoxic are there, and
Yes.
cardiac problems they can have.
Yes.
So Is there any? I don't think there are any questions. Let me find out.
Actually, we can go on talking about obesity for
Yes,
so
yes, 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 yes. The obesity is such a vast topic. Dr. Shalu is there? Dr. Shalu?
Sir, sir.
Dr. Lalit?
Yes.
Dr. Shalu, I think, please, your input and please conclude the session.
Yeah, I think
Thank you very much. I think we have had a very nice discussion from all the panelists. I would like to convey my thanks to all the faculty and the panelists. And now over to Dr. Shalu.
thank you, Dr. Puneet. Am I audible?
Yes, yes, please.
Right, right. No, I think we had a very fruitful discussion. I think as Dr. Manpreet already highlighted, obesity is a full day program. We keep on discussing about obesity and it will not end. Despite so much of discussions, the incidence of obesity is still rising. So I think we need a concerted effort both from all the colleagues together so that this menace of obesity is curtailed to as much as possible. I think if there are no more questions, we can just close the session.
Thank you, everyone. Thank you. Thank you very much.
thank you.
Thank you, Dr. Manpreet. Thank you, Jagjoti.
Thank you. Thank
And
you.
all the panelists. Thank you, sir.
Thank you.